Changing gears now, the United States is urging China to be more transparent about the current COVID-19 wave slamming that country.
Importantly, sharing information with the world about what they're experiencing. Again, because it has implications not just for China, but for the entire world.
China is seeing a massive surge in new infections. This is footage from a hospital in Beijing. It has been overwhelmed with patients, many of them elderly. And while China has only reported about 7 COVID-19 deaths this week, morgues in many cities are reportedly full of bodies. A hospital in Shanghai warned its staff this week to prepare for a, quote, tragic battle, projecting as many as half of the city's 25 million people could be infected before year's end. Here to discuss is Dr. Isaac Bogoch. He is an infectious disease specialist at the Toronto General Hospital. Dr. Bogoch, thanks for your time.
My pleasure, Brett.
So it's hard to get a full picture of what is happening inside China, and it can be difficult to reconcile some of the anecdotal reports with the official narrative. What is your understanding of what is happening in China?
I'm looking at the same reports as everybody else, but you do see some footage and some evidence that the virus is spreading rather quickly. You see evidence and documentation that healthcare systems are starting to get squeezed. And also there's some data and evidence demonstrating that medications like fever medications are in short supply in many areas that appear to be heavily impacted. So, we've seen this play out in many parts of the world before this, and, to no one's surprise, a big wave might be underway there, and we know how this can impact not just the healthcare system, but a society at large, and that's probably happening right now.
So China did drop much of its zero COVID policies a couple weeks ago, but the country has had years to prepare for the rolling back of those measures. So to what extent was this a foreseeable consequence?
Unfortunately, and again, we have to base this on the limited data that we have available, but it appears that as a population, they haven't really vaccinated or more specifically boosted populations and cohorts that would be more prone to severe outcomes, namely the older cohort of patients or the older cohort of citizens, pardon me. And, we know that COVID-19 disproportionately impacts older individuals. We know older individuals are disproportionately represented in hospital settings, in the ICU. Sadly, the older populations are more frequently succumb to this illness, and it's extremely important for those cohorts to have been vaccinated and boosted. And we also seen time and time again what happens even in the Omicron era when this virus sadly rips through populations that are under-vaccinated. Hong Kong, for example, around a year ago had this happen, and for a period of time they had the highest death rate on the planet. We never want to see this happen. Obviously, it's tragic to watch this unfold in China, but they would really need to boost quickly their vulnerable population to ensure that they can protect the lives of vulnerable people and also protect some of the integrity of their healthcare system.
Now, you mentioned there that China does have a population of more than 1.4 billion. So what sort of implications could a rapid spread of COVID-19 in that country have for other countries? For example, we do know that there have been supply chain snarls as a result of shutdowns linked to COVID-19 in China.
Right. I mean, certainly if a lot of people become sick over a short period of time, that can impact a significant proportion of the workforce. So it has massive ramifications in every sector. So that's certainly one issue. The other important point too is that we know that there's 1.4 billion people living in China. There's just 1.4 billion more people for this virus to infect. And of course, there's mutations that are going to continue to occur. There's variants of concern that can emerge. And if we just have a larger population, unfortunately, where this can happen. So again, luckily, we have excellent and effective vaccines that have stood up to more severe manifestations of the virus, namely hospitalization and death. And they've stood up regardless of the variant of concern. We've seen that hold up to the Alpha variant, to the Delta variant, to the Omicron variant, to various sublineages of the Omicron variant. So even though there's more people on the planet, that are now going to unfortunately be exposed to this virus, we still have very effective tools to combat it.
And Dr. Bogoch, I am curious, how concerned do you think officials in this country should be about what they are seeing unfold in China?
Well, I mean, obviously we're so closely intertwined from an economic standpoint and trade standpoint, and I'll let the trade and economic experts opine on that. But certainly, there is going to be several months where China will be impacted by COVID-19. But in terms of variants emerging and spreading elsewhere in the world, we've already seen that happen several times before from other places outside of China. We had the Alpha variant in the UK. We had the Delta variant from India. We've had the Omicron variant from Southern Africa, and all of these variants emerged in one area and infected other places in the world. So that's not going to be something that's just unique to China, for example. That can happen anywhere. But yeah, I wouldn't be surprised given the large number of infections over a short period of time in a country that has such a significant economic standing on the planet, that there will be global ramifications of this.
Certainly, and as an infectious disease specialist, what then will you be watching for next in the coming weeks, months, and days?
Well, you don't want to see anything bad happen to anybody. Obviously, we don't wish ill on anyone and to any of our friends and neighbors on the planet. And of course, that includes China. I think the key thing for them will be healthcare system capacity. That's been an issue anywhere else when we've seen COVID spread. We saw that very early on in China and Wuhan. We saw that in northern Italy. We saw that then in New York City, then in Iran. And then, of course, we experienced that here in Canada several times. And it's extraordinarily challenging. So their healthcare teams for the outpatient environment, for the inpatient environment, they're going to have a tough few months ahead as they really try to care for a population that's going to be needing their help more and more. So it's really sad to watch, and I obviously wish everyone well.
Do you think this was avoidable? As I mentioned earlier, China has had years to prepare and plan for something like this. Do you think what could they have done differently, for example, to prepare for this?
They could have vaccinated a more significant proportion of their population and boosted more of their population, especially older, more vulnerable individuals. I think some of the data we have demonstrates that the vaccines that were used in China perhaps aren't as effective as the vaccines that we were using in other parts of the world, and gaining access to those vaccines might have been helpful and prevented this. But one of the key things is truly protecting the population through vaccination before people are exposed to this virus. We saw that in New Zealand and Australia, which also had zero COVID strategies, and they were able to really prime their population with some baseline immunity to the virus before the virus was introduced when they opened up, and that served them extraordinarily well. China, unfortunately, just didn't do it to the same degree, and sadly, I think we're going to watch a very large wave impact China, and it's already starting to unfold.
Okay, we have to leave it there. Dr. Isaac Bogoch joins us from Toronto. Thank you for your time.
My pleasure. Have a great day.